Hi guys, it's the dental assistant tutor here, and I would like to go over how to place the ring kits in the patient's mouth. That way you can perform it on the job. It's very important that you watch the soft tissue inside the patient's mouth and to check before you place it if there's any bony tori, which could be on the palate or on the floor of the mouth, which looks like little hills and mountains of bone. Okay, that's very tender, and sometimes you can't get the ring kit in there and you have to try to freehand it. If that's the case, check my website out for the degrees on your phone while you're at the office if you need to on a radiology, and it will show you if you need a positive or a negative. Okay, so right now we're going to go over the placement of the ring kits. And we're in my backyard, so I have chickens and roosters, so you'll be hearing them in the meantime. Um, and how to take bite wings. Okay, bite wings are the x-rays that show the upper teeth and the lower teeth together as they're biting. Alright, that is a bite wing. A PA is a periapical, which is these ones in the center of the anterior teeth, the upper, the lower. These are the bite wings that go right here. When you're mounting x-rays, they go right here. Let's talk about mounting before we do placement, okay? When you're mounting x-rays, it's like the mouth is looking back at you. When you have actual films, there will be little tiny dots, okay? And they should all feel like braille facing out towards you, like a pimple, okay? Should face towards you. If they're backwards, then you will see a little hole and it will be wrong, okay? Now, you would normally start off either with your bite wings to mount them or your anterior teeth, okay? How you can tell the anterior teeth from the posterior teeth. One, they're vertical. The posterior teeth are horizontal like this, okay? Another thing is on the upper arch, the teeth are larger of the anterior and the lower are smaller, okay? You notice they're not biting on the roots. Some students will flip the x-ray upside down and it's like that's not how it will look in the mouth. So make sure you don't do that. Flip it over and make sure the incisal edges are all meeting together, okay? Next, look for any fillings, landmarks basically. If it looks this way on these bite wings once you mount them, well then you know the upper teeth will have the same fillings, okay? Same vice versa, the lower. You look at the lower bite wings and then look at the lower PAs. The PA shows the entire tooth in one x-ray, okay? Sometimes you aim for one tooth and you might get the neighboring teeth. That's okay, all right? Because sometimes the infection at the apex will go a little further, so it would be good for the dentist to see that. It's very important that you know how to mount x-rays within 5 minutes, and even though we're in a digital world right now, it's really important to know how to do it the old school way, just in case. Another thing is the smile line, okay? This bite wing looks like it's smiling. You want your x-rays to look like they're smiling. If they're frowning, the x-ray's upside down. Okay, so let's review. Dots should be facing out. Start with either the center teeth, which are vertical x-rays, or your bite wings, okay? Then you can follow along with the rest. Another clue is you're going to have your centrals, your lateral and cuspids, your premolars, and then your molars. Same with the other side. Your centrals, your lateral cuspids, your premolar, and molars. That's how you would put them in order. And we all know molars are bigger than premolars, okay? If you write these steps down, you'll know how to mount at the office. Always make sure you put your patient's name and date and the doctor who took those x-rays on these. And just so you know about x-rays, they are the doctor's property, but the patients do have a right to them, so you can give them a copy. Then we have the 4 bite wings, okay? And sometimes dentists will take vertical bite wings, so they'll be this way, All right, and that's to show periodontal loss or bone loss. If a patient refuses to take their x-rays, the office really should have a policy where they sign a consent form or refusal form for the x-rays. And nowadays, since it is digital, it is a lot less radiation. Remember, never to fold a lead apron unless it's not made out of lead, because you can crack the lead and it, over time, expose the patient to the radiation. Plus, you never know if you'll have to use that lead apron. Please never stay in a room to hold an x-ray for a patient, because over your career, it will have effects on you. Okay, there is a latent period, so please hold back from doing so. If it is a child, have the parent hold the x-ray in place, cover them both up, and then take the x-ray. If your dentist wishes to stay in a room, that's his practice, but try to get him to cover up with a lead apron. So let's talk about the landmarks. Okay, I have this sheet on my page at the dentalindex.weebly.com, and what you would do is you can just save it to your computer and then print it out, okay? And you can make yourself a little cheat sheet, okay? So what you do is in the center of the nose is the landmark for the premolars. Let me show you. You would take your ring kit, and this is for the anterior PAs. That one, all these. Okay? Now, these would be for the upper, flip it over for the lower. So you would have them bite down at an angle, aim for 8 and 9, your centrals. Okay? And then gently hold it right here, because if you just push this, you're going to maybe push it in the mouth. So if you hold it, you're guiding it. So hold it right here and bring it forward gently, okay? Now, sometimes these hurt, so make sure you move quickly once it's in place. Then you will take your your PID, which is the x-ray tube, and I don't have one at my home, of course, so take a cup if you're practicing at home with these, and you can order these on my page also, and you just line it up circle to circle, okay? Now, sometimes your PID will be square, and that'll be just fine because the film is square and that shows less radiation. And then they also have the ones that have the square in the center, okay? But circle to circle, just like that. Then you push the button and you wait for the beep to stop. Once that happens, you come back in the room and you can tell them to open, just don't let it fall out. That way it relieves that pressure on the tissue. And then you can move to either side that you're comfortable with first. Make sure you get a rhythm, a system going, okay? If you're using actual films, lay them on your table like a mount and flip them over to the color side or the white side, whatever you choose. There's no right or wrong. You're the dental assistant for your office. Just flip them over so you know if you get taken away in case of an emergency that you know where you left off, because your patient will. And you don't want to act like you don't know what you're doing. So always keep a system for yourself. Okay, or take them off and put them in a cup. Alright, so we have that. So now we're going to do the lateral and cuspid. Okay? You want to see the lateral and cuspid within that circle. Okay. Also, for the lateral and cuspid, it would be the inner of the eyebrow. Okay? So the nose is the centrals for the upper and lower. The inner of the eyebrow, take your finger, go straight down. That takes you to the lateral and cuspid. Same thing with the other eyebrow and the other lateral and cuspid. Aim it just like that. Circle to circle, just right, not like this. You'll get comb cut, but just like that. Go and push your button, come back in, tell them they can open. Then you grab it and go on to the next one. Once you have all three on top, then I normally just take it and flip it over. I don't have to do nothing to this ring kit. I'm going to ask them to lift their tongue, okay, so I can push this back with their tongue like that and place the ring kits. Okay, then you'll have them bite down. Kind of hard when it's a fake patient. Okay, just like that. And you see the centrals right there? Okay, and then you hold it and push forward. This is where if they have bony tori, it can become uncomfortable. Then you're going to move on to the lower lateral cuspid and the other one, lateral cuspid. Okay, ask them how they're doing. So for the lateral cuspid, same thing. Okay, you got your centrals and you got your lateral cuspids. Now we're going to move on to the premolars. Okay. The premolars would be with the yellow ring kit. Okay, and you would place it like this. Okay, see how it's pointing? It's kind of pointing out of the mouth. You want to do it that way. If you do it the opposite way, you're going to be choking them. Okay? So make sure you do your premolars. Okay, just like that. And then you hold it and slide it forward and circle the circle and push the button. The yellow ones become a little harder, the posterior ones, and how you can tell it's a posterior ring kit is it's like that. Okay? It's horizontal. And always make sure that when you put it together that it's not like this. Okay? That won't work. And it's definitely not like this. Okay? Because it's still not centered. You want to see it right in the center like that. Okay? That is your posterior ring kits for your premolars and molars. PAs. Okay? So this is the patient's right side. And the doctor says take a PA of tooth number 1 and 2. Okay? Or at least one area, because one's missing, and then 2 area. Okay? Because sometimes they'll take a picture of an area. And if you have to do that and they have no teeth or something, use a cotton roll. Use a rubber band, tie 2 cotton rolls, and it'll make it cushion for them, okay? So what you're going to do is you're going to line it up by number 2, because one's missing. And because the film is a little further back, you can get that number 1 area, okay? To see maybe if the tooth is impacted or something. And then you slide it forward. Same thing, circle to circle. Now, when it comes to the molars, okay, the premolars are the pupils. So if you take your fingers and go straight down, you're going to get the pupils. I mean, you're going to, silly, you're going to get the premolars. Same with the lower arch. And then the outside of the eyebrow will get the molars, okay? So on your sheet of paper, on the outside of the eyebrow, write molar for PAs. And then the pupil, draw an arrow and put pupils. I did it again. Need more coffee. But you would put premolars. Okay? When you're using it for the upper right, okay, for the premolars or the molars, just like this, you can take it and flip it and use it for the opposite side on the lower arch. Okay, so your upper right you can use for the lower left and vice versa. So if you're taking a full mouth series, instead of sitting there and unless you have 2 of these, to save time, you can do it that way. But I normally start with the centros and then the bite wings and then the rest. Because sometimes the patient will have a gag reflex and you don't want to mention the word gag because that will just cause them to do it more so. And they could end up throwing up if some patients have a real bad gag reflex. So what I do is I make sure that I save the hardest ones, which are the lower ones in the back, last. Also, have them raise their right leg as a distraction. By having them raise their right leg out of the blue while you're taking the x-ray, it's going to distract them. And then you can tell them afterwards. Tell them to breathe through their nose and move as quickly as you possibly can, making sure you hold your finger down on that button until it is done. Otherwise, you'll have to put them through it again. You want to try to get the x-ray right the first time and no repeats to save on radiation and to help promote, will save time basically throughout the office. The dentist is basically waiting for you to show them those x-rays, especially if it's during a root canal treatment and they need to take a working length x-ray. Chances are you're going to freehand that unless you use the ring kit that's green. It has a little block so the pulse or the files can stick up out of the tooth, because if that patient was to bite down with those files in the mouth, it's going to go through the apex of the tooth. So make sure that you tell your patient to stay open while taking these x-rays out or taking the files out. And for some reason the dentist asks you to take the files out after taking the PA, that's fine. Don't go down, just gently go up. And sometimes you might have to twist upwards. Just never go down. And place the same files that you use as a working length on your tray. And you can circle them on the tray so you don't lose them. And to write the working length on the tray sheet when you're doing root canals. I'm getting sidetracked here, but I just want you to know because you have to keep track of the working length in the endo files. So I would write WL, say it was 25 file at the rubber stopper was at 13 millimeters. You would write that down. Okay. All right. So let me show you with my mouth how you would place the ring kits. Okay. So for the centros, you're going to go nose, and then you're going to go in. Of course, you would have gloves on if you're working with a patient, and a mask. Okay. At an angle. And right hand. Some patients will try to do this and not bite down, okay? That is the worst, especially when you're doing bite wings, okay? Then you remove to the lateral cuspid. And then for the lower, this is where you haven't pushed their tongue back. Don't be afraid to push it back. I'm right home. And then lateral cuspid. That one hurt a little bit. Ooh. Okay. Then my bite wings, okay? And this is the horizontal one, which is just for the regular recall bite wings. And what you're going to do is the earlobe. So on your sheet, put by the earlobe bite wings. And you line it up either with the outside of the molars, which was what? The outside of the eyebrow was the molars, and then the pupil was the premolars. Sometimes that will happen. Now, let's talk about that. Sometimes people will put their ring kit like that. And this is... I don't know why they do that. I just never agreed with it. I don't like it. It don't feel good. Anyway, moving along. Now we're going to do the premolars again. On top of having the film here in the ring kit, they will also have plastic sometimes. So they can reuse the sensor in the office. And they have ring kits for sensors. And they're pretty neat. There's some that stretch to each sensor. And then the premolars. You just go forward. Ooh. Okay. And then, my least favorite. It's going to get my allergies acting up. But I'm not re-recording this. Okay. I'm still down to earth. Okay, so here we go. This is for the lower molars I'm going to aim for, okay? And these are my least favorite, like I said. You go in at an angle, okay, and the arrow's facing out. And use it to guide your tissue, the patient's tissue. And then I'm going to open up after you push the button. Also, the reason why I don't like it is because the floor of the mouth is very tender. Some patients have larger mouths, some have smaller mouths, and that's what can make it hurt, besides bony tori. Also, with this, you can push the tongue back too. Did you see how I went in as an angle and then pushed it back? And some patients will fight you, okay? Let me go back to the bite wing real quick. When they're biting down, bite wings, a lot of people will try to leave it open because it hurts them. So make sure when they bite down, you don't see this. That shows that it is not all the way closed. And so when you get the film back, okay, this area where it's black will be a lot larger, which will show less of the teeth. And the reason why we take bite wings is to show interproximally any tooth decay. And that's why a good bite wing will show, like, you can take a piece of floss. You can imagine taking a piece of floss and it looks like it would fit through that space with a good bite wing. A lot of people starting out tend to overlap their bite wings, and overlapping is when it looks like one tooth and another tooth are overlapping, okay? And that is on the radiology exam, so you need to know that. And cone cut is when you're not lining this up with the circle and it's up here, so when the radiation goes through, that part of the film is going to be clear, which is the cone cutting, okay? So make sure you do that. Alright, so remember, when you have to take a PA and the doctor asks you of a specific tooth, remember, if you count on the right and finish on the right, you're going to be right, okay? Most people have their wisdom teeth missing. Remember to count that space, okay? My doggy's moving the camera. So, it would be upper right, 1, remember these teeth, 8, 9, 16, 17 on your left, 24, 25, your centrals, and 32. If you can remember those teeth, then when the dentist says take an x-ray of tooth number 13, you know exactly where to go and what side. And you either count forwards or backwards. You have to be quick on taking x-rays. Alright guys, until next time, don't forget to like this video if it's been helpful to you. Subscribe because I will be doing more videos. And please, I've spent many hours on my page just to help other dental assistants out there have a good career as I have. It is, you type in the https semicolon / the dental index junior.weebly.com. Thanks guys. Until next time, be blessed. Bye.